How to use Otovent. Attach the Otovent nasal balloon to the nosepiece. It is very important to use the Otovent nasal balloon as it has been developed for the purpose of equalizing pressure in the middle ear. Never use a toy balloon as it does not produce the right inflation pressure and results in treatment failure. Place the hole in the nosepiece against the nostril. Whilst holding the other nostril closed with your finger, blow up the balloon to the size of a grapefruit. At first, this can take a few attempts. You should hear a click or pop in the ear. To clear effusions and relieve symptoms, make as follows. During the first week, use Otovent at least 3 times a day, morning, noon and evening, with 1 inflation in each nostril at each session. After 1 week, use at least twice a day, morning and evening. The normal duration of treatment is 2 to 3 weeks. After that, if you feel the need to continue the treatment, then consult your physician. Change the balloon after 20 inflations. The following are signs of a clinical effect in one or both ears. Hearing or a sensation of a crackling sound. Sensation of moving air or water. Improved hearing. Always read and follow instructions for use carefully.